Okay, good afternoon, everyone. Thank you for coming. This is the Community Resources Panel discussion, and we've got a wonderful group of panelists here that will talk about the resources in the community, mental health resources. My name is Lynn Nguyen. I'm one of the co-founders of Hope Clinic. I'm also the Associate Director of Research at MD Anderson Cancer Center, and I'll be facilitating this session. So we'll start by, I'll introduce each speaker as they speak, and we'll let them speak, and then afterwards we'll have questions. Okay? So our first speaker is Ms. Mariana Barajonas. She is with the Hope and Healing Center. She has part of the Hope and Healing Center is Gateway to Hope. It's the training branch of the Hope and Healing Center, and she's a community education coordinator. She has been in Texas since she was 8, so yesterday. She has her degree in psychology from the University of Texas, and she has been advocating for mental health awareness for the past 8 years. So she's going to talk a little bit about the resources that they offer.
Hello, everyone. So one thing is I'm Colombian, so if you hear an accent, that's where it's coming from. And to clarify, UTSA. So if you're from San Antonio, that's. I was like, trust me, I'd love to get to UT, but I went to the next best thing. So Hope and Healing Center, we do. It started with wanting to make an affordable and accessible approach to mental health care. So they had clinicians in the house to provide free services. There's a lot of great resources. They have what they call the CARES team that focuses in Alzheimer's, dementia, and that end of life kind of etiquette and education. But from all of that, we understand when you have like a body of a location, you're going to run into limitations, right? Maybe not have enough staff for the need that everybody's coming through the doors and signing up to get your resources. So the answer to that for our department or for our nonprofit was to really go out to the community and train the community, because who better than you to understand your zip code, your household, your church, your community, your schools, all of that. So whenever Gateway to Hope was created, it was actually by Dr. Matt Stanford, if you're familiar with him. He's the CEO, has a lot of knowledge, and it's a big shoes to fill. But the most important takeaway is just take it easy on yourself when you're trying to think about actions to take around mental health. You might be flooded with ideas, you might be flooded with options, but that may not necessarily be what's fit for you. So as we talk today, for myself, my slides, and even for what everybody's talking here today, really try to adapt the information to you and your needs, because all of this information really needs to make sense for you and what you want to get out of this. So how can we break the silence? Let me see. So one fact that, my title for my organization is Community Education Coordinator. It's to go out and do these trainings. How can I train the community to have this understanding of mental health awareness? We don't get too clinical. We just want people to feel comfortable talking about it, understanding it, and just get easy with that communication, right? This is one of the statistics that always, when I go to, if it's a faith community, if it's a school or workplace, they really jaw dropped, right? This was just saying individuals take about 11 years to reach out for help from the first time that they felt an onset or a symptom around mental health. Does that make sense? So the first time that maybe you experience symptom of depression or some other actual illnesses, it usually takes 11 years from the first time that was manifested within your body internally or even externally to take or to actually go seek help. How much can happen in 11 years without treating it, without talking about it? A lot. And maybe even things on top of it. So imagine stacking who plays Jenga? Anybody plays Jenga? How tall do you think that Jenga would look like if you've been building it for 11 years? Pretty tall. So that's why I always like to visualize the symptoms. It's life is life, things get hard, but if you don't talk about it, you're just creating that Jenga taller and taller. I always like to normalize that it's not impossible to treat it, but the taller the tower, the more you're going to have to take down, right? More of those building blocks are going to have to start tearing down apart and apart. So when we talk about building awareness, understand that. That's why it's important to acknowledge that for yourself and for your loved ones, your friends, your colleagues. Really understand that part. So one of the other things that I like to normalize is the mental health continuum. How many of y'all have ever heard about mental health in a continuum? Awesome. I kind of like that. Then I can teach you something new. But this is my favorite way to talk about mental health, because if we know anything about stigma, it's always been put in a way where this person has mental health issues and this person doesn't have mental health issues. But that's not realistic to look at, because at any point, I can find myself in that side of the continuum. Sure, maybe most of the time I live more on this side that is the blue side, that's called the well-being. That's just maybe every now and then during my day, I get stressed out, I get overwhelmed, but that doesn't keep me away from being there present for my loved ones, for work, to get things done. But maybe in 2 years, I have marital problems, which, to be honest, I think if you ever went to any of my conferences, I've been very transparent, because I was always the individual in my family that always had it together, that always had a very stable mental health world, well-being. But when I went through divorce, it was shaken. Luckily, I had a lot of resilience, a lot of support system, but I did find myself more in that middle where I had emotional problems. I didn't sleep well. I didn't have any anger or sadness. I just not had a lot of appetite. So that was like, a lot of my family members were like, what do I do? What do I do at this point? Some people were just be there for her. So at that point, don't get too worried or caught up in like, oh, I need them to go see counseling. Being there can easily be the first starting point. How can I be there for that person? How can I ask her, what do you need? Don't try to put your own perception of what needs to happen into the individual. Really understand, what do you need? And it just starts with a question, hey, I've noticed you've gone through something hard. How can I help? Do you need me? If you don't need me, do you need somebody else? Those type of questions can move me within the continuum. Now I can find myself in well-being. Sure, maybe I'm skipping breakfast, but I got lunch and dinner, right? So that's still a step. So really understand that I'm not always going to be in the emotional problem side, but if I get help, I can move back into the well-being continuum. But let's look at maybe another possible scenario. What if I went through a divorce? And what if I had a lot of debt? What if my family member got diagnosed with another physical illness and I didn't get help? I am more likely to move farther in that continuum. And if years go by and years go by, now I'm looking at myself up maybe having mental illness and staying in that continuum. And even then, either I could choose to not get help, or I could choose to ask for help or accept help. With that acceptability, I can find myself back in the continuum. Maybe it'll be a slow journey back into the well-being. Maybe it'll be fast. It all depends on the individual's resilience level, right? How much am I helping? How frequent am I able to afford care? Can I afford it every week? Can I afford it every month? Because those are all serious questions, and understanding what means do I have to be able to continue this care. So when we think about mental health problems, just understand that I had a couple of, sorry if I go over you, I'm gonna scoosh over. No, you're good. A couple of examples here, but well-being is, again, you're experiencing that occasional stress, but it's not impeding you from your everyday life, right? But you're planning, or maybe you're able to still show up and have some good coping skills that keep you in that side of the continuum, right? How about whenever you are going through something, finances? That's one of the big things it's impacting a lot of population regardless of your ethnicity, regardless of your religion. All of it, it's really impacting the economy, is really impacting everyone as a whole. So understanding what resources are you getting, or how are you getting help for that specific problem, because that will affect your mental health. That will affect maybe your family's mental health, because now they're seeing challenges that now they can't get access to something they used to get access to. So that change in lifestyle really affects the family. So, and again, with mental illness, if you do have a diagnosis, this is one thing I get a lot because I don't have a mental health or a license, and I go out to trainings. I actually get a lot more people approach me because there's not that fear that I can diagnose them. Because there's usually that fear that they don't want to talk to a mental health professional because they don't want to be diagnosed. So there's this sense of like, oh, I can talk to her about it because she can't tell me I have this because I don't have the licensures or I don't have the capability to do that. But I do have the ability to talk about mental health. But with that being said, when we do reach out to, it's not always going to be what I mean with what I wanted to make an example of that is there's a level that family, some support can play a role in, but understand too, the mental health professionals need to be involved in whenever you are needed. So understand that there is this continuum of not only your own health, but also of help. And it's very important to get connected to a mental health professional so they can help you move back into that continuum. If you have a illness like schizophrenia or bipolar disorder, you don't have to stay in that level where you're constantly distressed or you have a lot of limitations for your daily life. If you have the right treatment, you are able to come back to stability, to move with that continuum. And that's where hope really lives, that you're not just have this diagnosis and that becomes you. No, it's part of you, sure. It's who you are, but you can move into that continuum. Does that make sense? So when we talk about about mental health like that, even to your friends, if people are like, oh, I don't know if I want to talk about it, it's like, hey, I can find myself in that continuum. Even when we go to faith communities, the pastor can find themselves, executives can find themselves in that continuum. Everyone, no one is limited or prone to not have this. So really understand that this also applies to you. So what are another things that I always like to make awareness of is understanding what barriers apply to you in talking about mental health and getting help, normalizing this conversation. Usually we say the 3 A's for this one: accessibility, affordability, and acceptability. I know that I have some examples there that might not apply to you. We know that we all live in different environments, even myself as Hispanic. I live in Katy, and there's a lot of Hispanics. If you know about Katy, there's a lot of Venezuelans. I'm Colombian. And being Hispanic, even in Katy, feels like, where do I belong? Because even though, which I think a lot of y'all can relate, you might be from Asia, but then they clumped you on together with this community that has maybe different cultural traditions. Maybe they represent something, maybe they're good at a certain sport, and now they're telling you, oh, shouldn't you be good at this sport because you're within this culture, right? So understand your own environment and barriers. Maybe you do live in a community where there's a lot of the same people from your same country, town, and you have a lot of support there. But if you're in an environment where you lack that, then you have to really assess that for yourself. And a list here, sorry, I know you're good, but the list here might not be applicable to you. But again, I encourage you to really assess what applies to you and what impacts you. So let's go back to seeing see if I could work this. I need to be patient. I'm Hispanic. I like to move things, talk fast, move things fast. Let me know when you're ready. But again, accessibility. How many of y'all would say that accessing a facility to get mental health is an issue? Transportation. I know myself, for the Hispanic community, there are families that share a car. How many Asian American and Pacific Islanders families share a car? So maybe you're now having limited access on when you can even have transportation from your own house to these clinics, even if you can't get an appointment. So understanding that accessibility. We have harmful stereotypes, which that can also double dip onto acceptability. Language barriers. There might be some mental health professionals, but now they don't speak your language or understand your culture. And if they do speak your language, is it fluent? Can they really communicate that emotion that you really need them to understand what you're even going through? Because you might not be able to know how to label your own feelings. How can a second language of that speaking language do the same for you? How about lack of mental health professionals that understand your need? So when we talk about affordability, we know that there's also limited resources. And if you do find that provider that speaks your language, do they accept your insurance? Do they accept maybe a sliding scale? How many of y'all know about a sliding scale? Good, good. That usually is when the provider is able to adjust the price of the services based on your income. So ask about those things. What is my financial responsibility here? And if you're referring somebody to a mental health professional, know that information too, because that really will make that meaningful referral make an impact. Now, acceptability. We talk about it. Mental health stigma in your own community, that feeling of shame, disappointment that can come with experiencing these emotions because maybe your parents don't understand it. There's very little information about general history around mental health for the Asian American and Pacific Islander community because they haven't ever sought help for those diagnoses, right? So it's like, how do I really know my mental health history? But we know genetics also affect some mental health disorders. So understanding how to restart that conversation and get help for yourself so you can start tracking that history for your children, for your grandchildren. That's going to be able to normalize some of these conversations and the stigma around mental health. Limited accessibility, and also lack of mental health education. So the reason, again, that why we really went out and tried to train the community, it's because we know that we gotta help you understand. And as much as we want to talk about crisis prevention, which is great because that's truly at the point where most people seek help, we need to start feeling comfortable with what's the starting point. But you can't start if you don't know how to talk about it or how to even acknowledge mental health. So once we normalize that, we can start running. How many of y'all just need to get through the first mile? And then you're probably thinking about running the half marathon. Just train there, get there. But yeah, so again, Again, the biggest thing is get connected. I know we have a lot of resources. There's some that are faith-based, some are just general. My first experience with the Asian American and Pacific Islander community was last year in April. We were asked to go talk to a very dominant Asian American church in the Sugar Land area. And that was beautiful to see because if we know anything about statistics is that the Asian community is the least likely to seek help or to talk about mental health. So whenever we're able to at least start somewhere, it's a great thing to see. Of course, seeing Hispanics and the Hispanic community also normalize that because we're also right there at the bottom of normal seeking help. It's a beautiful thing to see, but also get connected with all of the other providers. NAMI is a great one. We refer to NAMI all the time. So get connected because as much as we have things available, they might not apply to you. Maybe you need something different. Maybe you need to just refer people out. Maybe you're ready, but your family member's ready. So just my biggest passionate is start somewhere that feels right for you. And I think that's the best way that we can start creating the conversation around mental health. Mm-hmm.
Thank you. Thank you, Mariana. So our next speaker, and if you will please hold your questions until the end, but our next speaker is Miss Angelina Hudson. We're very fortunate to have her here. She is the Executive Director of the National Alliance on Mental Health Illness for Greater Houston, and it's also known as NAMI. She is a mental health advocate, a spokesperson, a trainer at the local, state, and national levels, and for more than 2 decades. And she focuses now her efforts on identifying at an earlier stage those facing a mental health condition and removing barriers to mental health services and supports and decriminalizing those living with mental health conditions by encouraging appropriate treatment options and connecting adults to employment opportunities, cross-training, and entrepreneurial development.
Thank you. Thank you. If you don't mind, I'm going to stand so I can see the screen because I can't really see what's on this. It turns black from the side. So I need to be able to see the screen and my timekeeper so that I don't talk too long. But really, I work for NAMI Greater Houston at this juncture. I've been with NAMI for 23 years, but I started off as a mom. I have 3 children diagnosed, and I can talk on and on about them. I brought one with me who's rushing me out of here today, but because I've made a commitment to take him to Half Price Books. Don't get me started. But I want to tell you a little bit about what we've been doing in the Houston area for now 34 years. NAMI started in Houston 34 years ago. All right, 1988. So what do we do? Have everyone in here heard of NAMI before? Yeah, when I first started, I would do that and no one raised their hand. No one said anything. But we were doing something a little different now. So these are 4 main pillars: education, psychoeducation, advocacy work, support through support groups, and one-on-one support through our telephone care team at the office, and then public awareness like I'm doing today, right? So we go to conferences, we'll come anywhere anyone calls us to go. And all of these services are free. One of the main things about NAMI is that we made a pledge, our board of directors, no one pays for NAMI services. Do they cost? Yes. But we don't charge for them, all right? So we serve families and individuals at no cost. And the reason we do it is because in 23 years that I've been involved, things have not really changed. The needle has not moved in the state of Texas. As a matter of fact, half of the children, 60% of adults do not receive treatment. The stigma is still very high. I don't know if I'm born and raised Houston. I don't know if anybody here, are you from Houston area? Are you from Columbia? I'm sorry, she said that. But if you're from here, we got a lot more people now than we had 20 years. We have more people now in Houston than we had 10 years ago. I mean, that freeway, can I tell you? So the problem is, though, because of the stigma, that's the #1 reason why people do not get help. And what I've learned is that it's not just the stigma of other people, it's our own stigma. We come with our own. I remember when my dad first realized that my son here was going to have, this lifelong chronic, and my dad, he passed last year at age 93. He was born in 1929 in East Texas. You know what he told me? He said, Angelina, look, when you have children born with brain disorders, stuff like this, and my dad loves me, okay? But he said, you don't have to take him outside. We'll just make a room. I can build something in the backyard. We can just keep them home so that people don't, and he told me a story of how someone he grew up with, when things went bad, they always assumed it was this young man. And so I said, you know what, Daddy, I appreciate your support, but we're going to live our life out loud. We're going to take him everywhere. We're going to do everything. And now I can't even get him to stay home when I got to go speak at a conference. So NAMI helped me do that. And I'm going to tell you how. The first thing they introduced me to was the stages of emotional reaction. Every family who deals with a diagnosis experiences a trauma. It is a trauma to get a diagnosis of any chronic disease. It doesn't matter what it is, but mental illness is probably by far the worst. That is the most, we used to not talk about, the little C, y'all know the C word? We used to not talk about cancer. People older than me would hold up the letter C. They wouldn't say the word. Am I blocking someone? And then guess what happened in the 90s? We had that big disease with the little letters, HIV. All right. We didn't talk about AIDS. Now we talk about AIDS, but we still don't talk about mental illness. And that's why our name is NAMI, the National Alliance on Mental Illness. We thought about changing our name, but then that would buy into the stigma. Mental illness is an illness like any other part of the body. There are predictable stages of response, and the research indicates that bottom line, like crisis, anger, understanding, that is what people need when they're in those stages. And we help families, individuals figure out how to get the things they need. When I met NAMI, I sat down at a table. I didn't want to be married anymore. I didn't want to talk to my parents anymore. I was wounded. I was devastated, lost, hurt, confused. You know what I needed? Number one, I needed psychoeducation. I needed support. And that's what I got at no charge from NAMI. The family is just as impacted as the person who's diagnosed. The person who's diagnosed is like someone ripped the rug from under their feet. Most of the people that I used to meet when I first started with NAMI were between 19 and 24. Right after they get out of high school, they're going to college, they were living their best life, or they just graduate from college, they get their first apartment, and guess what? Their first psychotic break. And they are angry. They are hurt, they're confused, and they want somebody to help them put the pieces back together. Well, the family has the same problem. They're just as sorrowful and raging and anger and grief and fear, all of these feelings. And what do you do when all you have is emotion? So the right side of the brain is experience and emotion. The left side is logic and reason. Anybody will tell you when this brain on this side is flooded, this one's not working. Right? So NAMI uses psychoeducation, much like you were describing, community education, but it's intimate. What do I mean by intimate? Our classes are 10 to 20 people who are all struggling. Either they have their own diagnosis, that class is called peer-to-peer, or they are the family members, loved ones, fiancés, boyfriends, girlfriends of those who are looking at the loved one struggle. And that class is called Family to Family. We offer this class in 6 languages: Farsi, Arabic, Mandarin, Spanish. I'm not going to remember all of the languages, but our goal now, what's different now from 20 years ago, we had about 50 teachers, 50 of you. And we went out and we taught all of the classes. Guess what? When I came to NAMI, most all of those teachers, save one, were Anglo-American, right? And guess what? There was no class in my neighborhood. I grew up off McGregor near HCPC. I don't know if y'all know where that is. Near the medical center, okay? There was no class over there. There was no class in 1st Ward, 3rd Ward, 4th Ward, nothing in the loop. Well, West University. But the closest class to me was in Sugar Land. And I went to Sugar Land for 12 weeks to figure out how to save my marriage, how to love my family again, and how to put the broken pieces of my life back together. And that's just with one of them diagnosed. Later, a year later, I had a second child diagnosed, and 6 years later, I had my baby, my Yahoo. I call him my Yahoo. So as adults, they're all adults now. I have 1 diagnosed with autism and 2 diagnosed with bipolar disorder, and they're all successful. They're all doing well. And it was when they all got out of school, especially the Yahoo, I changed my phone number. I didn't want anybody calling me ever again about them 3 children. So I changed my phone number. But NAMI helped me make it. So what we have are free presentations, free support groups, and free classes. I told you we were different, and this is how. We no longer have those 50 teachers teaching those classes. A lot of them kind of left after the pandemic. But you know what we have now? Oh, some of them still there. We got about 20. But what we do now is we take this research-based, evidence-based programming and curriculum that is already translated into 6 or 8 different languages, and it's medically reviewed every 2 years, and we train people in your neighborhood. You want a class at your school? Okay, let's train you, go teach it. You want a class at your, your place of faith or at your workplace? Okay, we'll train you. You go. If you want to open up you're a student? Yeah, you want to open up a support group? We train you, you go run the support group. And you run it with your cultural sensitivity, with your life experience, with your background, and you invite people that are interested in listening to you, share this. And the other thing that makes us so unique is that every single person that runs a class or a group, they have lived experience. They know somebody, they love somebody, or they are the somebody. Why do I know you? Jen. But yeah, I know you. Oh, that's what it was. So here's our approach. Our approach is that mental health conditions are no one's fault. When families come to us with their broken pieces, guess what they believe? It's their fault. For 7 years, I cried. 7 years, I thought it was my fault. Thank God for NAMI. It is a catastrophic, it is a traumatic event, and there are ways to respond to trauma. We have the biopsychosocial model, which means bio, get a diagnosis, go to your PCP if you don't know where else to go, get a referral, talk to someone. Never ever, we go to schools all the time because parents in schools, when their children have behavior problems, they get a IEP or they get a label for special ed or some treatments, or they can become 504 students. But guess what the families never do, or often never do? I shouldn't say never, but sometimes never do. They will not go to a doctor. They will not get a clear diagnosis. And most of mental health conditions live in the neurology of the brain. I tell them all the time, go to a neurologist, get a full battery of tests. Because usually when one thing is wrong on the outside, there's something else going on the inside. Do you know how, now this one was diagnosed because he didn't talk for 7 years. You're talking now, right, Q? You talk now? Yeah, 8 languages, this one right here. The other 2, they didn't have behavior. They were yes, ma'am, no, ma'am, mostly because of my husband, not because of me. They were very well mannered. I was pulling my hair out. He was like, oh, no, you won't, right? So they had auditory processing disorder, visual processing disorder. One of them also has olfactory processing disorder. These sensory disorders, you're not going to recognize what it is unless you go to a professional and get it diagnosed and treated. We came out with this book last year. It's called You're Not Alone. The first half of the book are all medical professionals, clinicians, researchers from all over the world. Dr. Ken Duckworth is our medical director, and he took the most common questions that he receives nationally from family members. Again, we are a grassroots organization. If you or you have a question, guess what? We send it to Dr. Duckworth, you're going to get a response. I don't know another organization that does what we do. And that's why I've been hanging with them for so long. The second half of the book is anecdotal. These are stories written by, I'm chapter 7, by the way. Someone called me and said, how do your children feel about you telling all their business? I said, their business was my business for 20 plus years. But the youngest one, I called him the Yahoo because he's not so cool with it, But the other 2, they're fine. But yeah, there's another, this book is like any age. It deals with mental health conditions across the continuum of wellness from 0 to 99. There's a second book coming out next year that's going to focus just on children. And listen, if you can't get this book on Amazon, if you write me or call me, I got a bunch of them. I'll just give you a book. But I just wanted to deliver this message here, and that is do not give up hope. Some of the situations that we hear in our office, especially from the Asian American community, we don't get involved with the family until it's far, far progressed. We're looking at bouts of suicidal ideation, psychosis. For whatever reason, in the Asian community in particular, it stays quiet until it's really an extreme nature, right? But I want you to hold your head up. Most of these individuals do go on to live a life that they're proud of, and their families do stay intact. We are family to family. That's how we help people. That's how we support people. I put my name and number and my email address here in case you want to reach out to me. But we want to embed psychoeducation supports and support groups in your community, in your language, and the training and the materials. It's all free. All right, thank you.
Wow, that was amazing.
Thank you. I've got a lot of questions, so I'm going to ask after we're done.
And our next 2 speakers are from Baylor College of Medicine. I think we have Dr. Phương Nguyen. He is an associate professor in the Menninger Department of Psychiatry and Behavioral Sciences at Baylor. And he has his doctorate in clinical psychology from the University of Massachusetts in Boston, and did his internship and postdoctoral fellowship at Mass General Hospital, Harvard Medical School. He is currently the Director of Psychology Services at Bentall Hospital. And He serves as the training director for the psychology internship program.
So, and I've got the next speaker and his team is Dr. Zoe Ng. Oops.
Oh, I'm sorry. Hold on for a second. Dr. Phương Nguyen's research interest is with underserved, marginalized groups, racial ethnic minorities, and refugees and homeless individuals, and as well as human trafficking survivors. So our next, his other team member is Dr. Zoe Ng. She is a postdoctoral fellow working with Dr. Nguyen at Baylor College of Medicine, and her doctorate in clinical psychology is from Wheaton College in Illinois, and she's working now at Baylor. She currently provides psychology services in the psychiatric inpatient unit at Bentall Hospital and consultation and liaison services throughout the hospital. She is wonderful in that she has trilingual skills in English, Mandarin, and Cantonese. So they'll talk a little bit about their services at Bentall.
I think I'm gonna steal Ms. Hudson's idea to stand up, and I think it's easier to do it this way, yeah. Thank you for having us today. Earlier, Mariana had talked about the continuum of mental health. And so I think it's a really good way to think about mental health. We all experience difficulties day to day, living our lives, and then things can sort of pile up. And then there's also the other end of the continuum where folks have been born with some kind of psychiatric illness or physical illness. Dr. Ng and I work at Bentall, and so we treat people on the very far end of the continuum. Oftentimes, Asian folks will not seek services along the way until absolutely necessary. And so by the time they see us at Bentall, they're in really rough shape, you know. And so these sort of community forums are very important so that we can bring awareness to this continuum. What we want to try to prevent is from people needing those acute care services, because at that point, it's very challenging and it's very stressful. You can imagine how much family members have experienced by the time they see us. Patients are often brought in unwillingly also, or brought in by emergency personnel. And so at that point, it's a very challenging process. So Dr. Ng and I are going to talk a little bit about more practical aspects to obtaining care. We are Baylor College of Medicine personnel, but our clinical work is all done at Bentall Hospital. Bentall is a major training facility for Baylor College of Medicine. So I'm going to talk a little bit about Harris Health System, and then we're going to talk a little bit about Bentall, specifically the services that are available there. And then we're going to go into barriers to care and then what we can do about it. So most folks know about Harris Health System. It's one of the largest integrated healthcare systems in the country, actually. It includes community health centers, same-day clinics, specialty clinics. There's a dental center. There are mobile health units, and then also 2 full-service hospitals. Bentall is one of 2 level 1 trauma centers in the Houston area. So in a city as big as Houston, we only have 2 level 1 trauma centers. So these are the places that people get brought in for life-saving measures. The other being Memorial Hermann. And so we see the most challenging of cases, life-saving measures are often required. The second hospital that's associated with the Harris Health System is LBJ on the northeast side of town. And that's undergone some expansion, and it's a level 3 trauma center. And so if you think about Harris Health System, it's kind of like a wheel. Bentall is the hub in the center of the wheel. And then we have over a dozen community health clinics that are located around the city. And so those community healthcare centers are more accessible. If anyone has ever tried to go into the medical center, you just know how difficult it is just to find parking, right? And then the cost of parking. And so that's a very big challenge for folks. And so if we have facilities like the Hope Clinic that are in the community that are accessible, that have free parking, then access to care is going to be a little bit better. These are the community primary care locations. So if you see, there are lots of them. And so earlier here, you can go to harrishealth.org and you can actually look at a map and it'll show all the locations. All of the primary care locations have mental health services. This is very key because of this difficulty in accessing mental health services. A long time ago, before I started at Baylor, I used to work at Asian American Family Services. I was their clinical director. And for those of you who maybe know about AAFS, it was kind of a beacon in the community, located right in the heart of Bel Air. And so there was this huge sign. You would drive down Bel Air and you would see Asian American Family Services. And so it sort of pulls people in who maybe need help. That no longer exists, right? That model of care is very challenging to sustain. And so now we've moved into more integrated care, and it's a more sustainable approach, I think, to mental health care. But the challenge with that is folks will need to get referrals. Team members need to be aware of issues that are important, that are relevant for the Asian community. And so this is the model of care that we have here at Hope Clinic. Strategically placed here to provide services for the Asian community. And so I'm very happy to see that the Hope Clinic is here and is growing because I think this can become a beacon for the Asian community. People can drive down the street and say, oh, that's where my doctor is. That's where I can get support in my language by people who know about my culture, about my experiences. And so that's the model of care that we have currently. Ideally, we would have many Asian American Family Service centers around. But interesting, in a city as large as Houston, there has not been anything like that since it closed, which I think has been quite sad, I think, for the community. So these are sort of the practical things that we have to deal with. These are the systems that we sort of have in place. Ideally, folks would be in the community getting these mental health services and healthcare services in the community so that they can avoid the issues becoming more severe. If they do become more severe, then they see us at Ben Taub. So Ben Taub is staffed by a team of psychiatrists and psychologists that are trained to deal with more acute issues. And so at Ben Taub, we offer mental health inpatient as well as outpatient care. And we also include an intensive outpatient program. So these are folks who have very chronic, very challenging issues that require a higher level of care than a master's level, maybe a master's level clinician in the community. Primary clinical services at Ben Taub include our psychiatry clinic, our psychological assessment clinic. So if you are interested in better understanding what is happening or what's happening with yourself or with your family members, undergoing psychological assessment can give you more information about what's going on. It's kind of like going to a mechanic, right? If you brought your car to me, I'm a psychologist. I can't do anything except hit the button to turn it on, right? I can't tell you what's wrong with your car. So I take my car to the mechanic, right? And what do the mechanics do when you bring your car in? They plug it in and they run an assessment, right? And so all these numbers spit out and they tell you exactly what's wrong with your car. So then they can overcharge you for the services, but at least you know what's wrong, right? And so don't be afraid of that assessment piece because the more information you have, the better we can do about treatment. So psychological assessments are a very specialized skill. Only psychologists are able to do these kinds of things. So that's why you would come to Ben Taub. Folks will come to the psychiatric emergency room 24/7. Anytime someone has a need for a high level of care, come to Ben Taub. There's always someone there 24 hours a day to help stabilize what's going on. If you make it through the emergency room, then you'll see Dr. Ung and I on the psychiatric inpatient unit. And that's where folks have gotten stabilized. And then we are trying to plan for appropriate care afterwards. The hope is that we don't see you. The hope is that we're getting treatment in the community for ourselves or for our loved ones. Ben Taub and Harris Health System has access to 150 different languages. Language is very important when you're talking about healthcare, mental health care in particular. At Ben Taub, we provide in-person interpreting for Spanish and also Vietnamese. Vietnamese is the second most commonly spoken language here in the Houston area, second only to Spanish. So interpretation services are actually required. If you are getting healthcare and those folks are getting funding from the government or from the state, they have to provide interpretation services. And so if you're here for a loved one and they are afraid to talk to someone because they don't know the language, you can educate your family member. That's required by law. We have to provide that. Now, obviously, it would be better if the provider or the clinician could speak that language. But again, we are working with systems that are not perfect, right? But not perfect is still better than nothing, is our attitude. It's got a lot of information here about patient eligibility. So who knows about the Gold Card? Ever heard about it? Right? Gold Card has been around for a long time because Harris Health System has been for a long time. They don't call it Gold Card anymore. Actually, we do, but we use Financial Assistance Program, formerly known as the Gold Card. But the reason why it's called the Gold Card is in the past, you'd sign up and they would send you a Gold Card in the mail. And you would show up and give people the Gold Card. Gold Card is not free healthcare, right? There is a sort of common misconception about what the Gold Card is. It's based on household income. So people can qualify for financial assistance. Depending on how much your income is, you may pay nothing, or you may pay a little bit more based on your income. So there are a lot of ways to sign up. The most easy way is online. There's an online application, or you can apply by mail. There are also drop-off locations, right? So you can fill out that application, you can print it out online, and you can bring it to these facilities. These facilities actually have people that will receive the application and they can answer questions as well. If you need this information, I can give you my card and you can email me and I can actually send you a copy of this PowerPoint, okay? So access to care is very important. The other piece is recognizing when do I need to bring my family member in. I'm gonna hand it back. I'm gonna hand it over to Dr. English. She's gonna talk a little bit about common mental health concerns.
So I'm aware of the time. Let me be quick. Okay. So I think that one of the very important thing is that like when you talk about AAPI mental health issues, like what should we look out for, right? So like when you have yourself, your loved one, your family members, your friends, so like, oh my gosh, like what should be, what I should be aware of. So from research, we identify like depression, anxiety, trauma abuse, or suicide is more like prominent among the AAPI communities. But like, okay, like what under each of the category? To here, I want to refer to the spectrum, the continuum. So it is not that like always the most severe cases, but if you have noticed some of the symptoms, maybe it is good to talk with your loved ones about it. For depression, not only feeling depressed, feeling sad, feel like crying, a lot of behavioral symptoms that you can actually take notice. For example, maybe your son has difficulty getting out of bed. Always lying in the bed, staying there all day, and not sure like why he is not interested in doing schoolwork or like even going to work. And you may notice like your loved one, oh, he hasn't showered for 3 days. Like you cannot take care of your ADLs, like brushing teeth, going to shower, even not combing your hair. Then there's that might be actually signs of depression. And of course, also I think you always talk about like, I lose appetite, I lose weight, or you eat too much, right? You're gaining weight. So like not only sleeping too much, but like, oh my gosh, I have insomnia for like 2 weeks. So they can be depression symptoms. And of course, like more severely that you can, that person have suicidal thoughts, feeling worthless, feeling like hopeless. There are also some symptoms of depression that we can look out for. And for anxiety, I think there's two big main category. One is you have a lot of worries all of the time. So you could like ruminating, like raising thoughts that about something that is what if. Okay, what if that happened? For me, like what if I could not stay in Houston? What if that? So then I become crazy. Or you have a lot of bodily symptoms like I couldn't breathe. Like I feel like I couldn't even breathe in this area. I have like heart pumping, like my heart pumping really fast. Like I feel tingling in my hand. I feel numbness. I feel weakness. I'm almost like dizzy. I want to like faint. So these are all anxiety symptoms. So if you have like a lot of thoughts going on, or you have a lot of bodily symptoms, that might be you can just go to see us, maybe not Bangkok, but maybe them first, that's very helpful. And then trauma. So for AAPI community, if you immigrate here, this is your generation, you may experience some trauma already. Or you have to like being acculturated here, you have like another level of trauma. Of course, like this is like disaster. That's also trauma. But what should you look out? Like, do you have nightmares? Do you have like recurring memories about that incident that are always coming up? Flashback, almost like I just stand there, but the memory just come back in front of my eyes. I was like, oh, I'm reliving the experience right now with no idea why. So these are also like symptoms of trauma that you may want to look out for. So more severe kind of trauma symptoms would be like, I'm feeling unreal, like I'm like going into like a cloud. I don't even know that what I'm walking on is almost like I'm like unreal. Or sometimes you're like, I see myself as a third person. So these are more like depersonalization experience. So these are the things that you can look out for. And of course, the most severe thing, and this is also my expertise, is suicide prevention. So there's a more obvious. For example, when you have a friend who always talk about, oh, I just want to die. Don't take it lightly. They may be communicating the suicidal thoughts, okay? Or they may even like doing like things to start preparing for that. For example, like accumulating medications, looking for places that they can jump in front of the train. We have a lot of them there for Bangkok. Like all those things that are like getting prepared, or like self-harming behavior, like taking drugs, alcohol, or even self-harming, like cutting. So these are the things that we should look out for. And we can, of course, after all this depressing thing that we talk about, there's ways that we can overcome it. But before that, we also can talk about barriers.
All right, I know we're pressed for time, so just one point to follow up on Dr. Ng's sort of symptoms. If it interferes with daily functioning, those are the first kinds of signs. Can't get out of bed, don't want to brush your teeth, don't shower, can't keep up with tasks. Those are like the sort of first signs. So paying attention to those is really important. Lots of barriers, obviously. We don't have time to go all over them. The thing I do want to bring your attention to is this aspect of culture. For Asian people, and a lot of folks, they belong to a more sort of collectivistic culture. There are a lot of beautiful things about coming from a collectivistic culture. We pool resources, we make decisions together, but it also causes limitations too. One of the primary things is a fear of shaming the family, the fear of embarrassing folks who are associated with you. And so that shame, that guilt really prevents people from getting the help that they need. Asian people are really bad about shame and guilt. I know, I grew up with it. We want to protect our families. We want to honor them. And oftentimes we self-sacrifice. How many folks know parents that give up everything for their children and then suffer because of it and are really bad at self-care? These are the things that lead to mental health issues. And then I'm just going to jump into the last slide. So there are a lot of things that we can do to overcome mental health care. Psychologists are well trained in the art of psychotherapy. So psychotherapy can look like a lot of different things. It can be insight oriented, trying to discover aspects of yourself, trying to have a better understanding of why we do the things we do. But it also can involve specific kinds of treatment for the clinical diagnosis. So if someone suffers from depression or anxiety, there are very highly specialized therapies that we have found to be very important, very helpful in the treatment. Medications. Asian people hate taking medications. Like I can't even convince my own parents, and I'm a psychologist, or they'll take the medications and they'll take half of it, or they'll take it every other day, right? And it's just not effective, right? And so being here, you must have interest in mental health issues for Asian folks. So part of your responsibility is to educate the people in your lives. Let them know there's this combination of psychotherapy and medication that can be helpful. Asian people love healthy styles. That's not hard to encourage people to take part of that, but that's also very important too. But again, engaging in those ADLs, those activities of daily living, eating, sleeping, exercise, those are like things that help bring that balance. And then connecting to medical personnel who are highly specialized. There are lots of specific, highly effective treatments now for mental health conditions. Things like ECT, deep brain stimulation. There's a lot of science now that we know that can help with the treatment of these different mental health conditions. So again, I'll have cards. If you want copies of this PowerPoint, I don't know if we can actually get it copies of it here today, but if we can't, then you can email me and I can send you the information from the slides that we had earlier. Okay.
Thank you, Dr. Nguyen and Dr. Ng. Thank you, everyone, for just fantastic, interesting, really helpful discussion. I actually quite learned a lot. I really love the, I just wanted to summarize, I love the concept of thinking of mental health as a continuum. I know for Vietnamese Americans, we don't really have a concept for mental health. We have a concept of you're normal, you're okay, or you're crazy, right? So it's really hard to get the families to thinking about, well, maybe, you know, I'm not crazy, but I need a little bit of help getting through this hard time. And so that's really great to think about that. And regarding NAMI, I just love it that you have these support groups and that you're kind of now you're using people from the community to facilitate it. And my question for you is, how long do these support groups last? Do they last as long as the attendees want, or is there a finite time?
Very good question about support groups. So that's my favorite program. Don't let anybody kid you. In NAMI world, everybody has a favorite program. And my favorite is the family support group. So I'm a state and national trainer. The support groups last as long as the facilitators choose to open the groups. They are 60 or 90-minute sessions. They meet once a month, twice a month. Some meet weekly. I discourage that because you can burn out as a facilitator going every week. It is a model. So there's a beginning, a middle, and an end. It is not a care and share group where you sit in a circle, pass the Kleenex, and everybody just tells you their problems. No. It assesses in 1 minute, everybody introduces themselves, who is their relative or what is their illness, and for how long and what's going on right now. The trained facilitator uses that 1 minute of information to figure out who to go to first, second, and third. Hot potatoes, hot critical issues first, traumatic issues first, pressing dilemmas, reoccurring themes, and then quick fixes. But that support group does its own work. The facilitator is not the answer person. So if you're worried, well, I'm not a clinician, I'm not trained and certified, you don't have to be. All you need is a big heart and availability of time to open up. We had 2 Asian American groups when I first started. We have 0. We have 0, which means the facilitators were both AAPI, right? And can I tell you why they closed their groups? our insurance company. Those groups were in their homes, and our insurance company would no longer cover groups that were in private homes. So we are open to have a group at the Hope Clinic or we have a group now at the Hope and Healing Center. I'm gonna talk to Dr. Shaw about opening one at the Ben Top. We already have a table at the Ben Top. We partner mostly with hospitals and clinics. And then we offer our classes across the street at the big church or down the street at the community center, but it's wherever the facilitators want to meet. They can go on for years. We have 20 and 25-year support groups. We have groups that opened in July. So it just depends on, we have one group, they close 3 months a year and they open up again in the fall, you know. So it just depends, it's really up to the facilitator. And then we have refresher trainings so you can stay fresh. We provide all the materials. If there's a question in your group and nobody can answer, you can send them to the office and we have a telephone support system and we'll answer them one-on-one.
That's awesome. Thank you. And yes, and you had a question?
Yeah, this was for the doctors at Bentob. Did you say you are seeing Asians in Bentob? What are the ages and what are the issues, or it runs the whole gamut?
So Bentop is an adult hospital. So a lot of time we see adult patient. For outpatient, we also do child and adolescent, but it's a less scale, a smaller scale. So we usually see people from 18 years or older. So for us, we occasionally see Asian folks there, but not a lot. But because we are more like severe mental illness unit, inpatient unit, so when they get there, it is pretty severe at that time. I think one thing that I'm glad is that we are able to provide the language that are suitable. So say I can speak Mandarin and Cantonese, then I would just use it with them. If fitted, and we have a lot of interpreters. So that is also very helpful.
So I think we have like a specific sample in our patient population. So by the time they see us, these are folks who have suicidality. These are folks who have untreated bipolar disorder or schizophrenia, major depressive disorders. These are like conditions that require intervention. And so, like I said earlier, ideally they would be treating in the community so that they can avoid the mental illness sort of worsening over time. So, yeah.
Yes, Christina.
So I think maybe as a community, we may notice somebody has maybe some kind of a symptom. How do we encourage them to go see, not maybe psychiatrists, but in the community?
So I think the question is like, how do you encourage someone that to come and to seek help, basically? Anyone who wants to take that, or okay.
I have one response. So there's two types of people, right? There's one who it's a very mild situation. They may not want to go to a psychiatrist or a psychologist, right? First of all, you calling me crazy, right? So but they're support groups. So what issue are they struggling with? Are they struggling with the loss of a loved one, a car accident, loss of job? What are they dealing with? There's a support group for everything. There are grief support groups. There's parents who've lost a child. So get them closer to support domestic violence. There's all kinds of support groups, and then see if they'll go to that. And if they don't, tell your primary care physician. Usually people go to the doctor once a year for a checkup. When you go for your checkup, tell them you're not sleeping. Tell them you have nightmares. Tell them you haven't cleaned your house in 6 months. Tell them you stopped eating, you know, for bouts, or you lost your job. You know, tell your PCP. Now the PCP, they are more inclined to hear it may be a mental health problem, and they'll give you a packet. They'll do a depression screening. The PCP is a very solid place for intervention. Now, if it's a more serious thing, suicidality, not leaving the house, you know, really bizarre behavior, Dr. Javier Amador wrote a book, I'm Not Sick, I Don't Need Help. He also created a program called LEAP, L-E-A-P. And the LEAP program helps you talk to a loved one about serious mental illness who may not see that they have it, and it gives the caregiver ways to push them towards help.
Awesome.
Yeah. Sorry. I think that she highlighted something very important, and it's just really understand what that barrier is for getting you from point A to point B. Maybe you're trying to get to point F, right? So it's like, but really understanding, meet them where they're at. Don't give up on them. I know we've already heard that. Really don't give up on them, because they might dismiss their own symptoms like, I don't need help, or I'm fine. Really, maybe not try to pull too much, because maybe when you try to pull too much, you actually create another barrier. So really being like, well, just so you know, I'm there. Questions like, how can I help you? How can I get myself involved in activities, physical activities? Mental health is, mental health is not isolated. So you never know what other parts are affected. So really get them, really try to understand that. And lastly, if there's still that stigma around seeing a psychiatrist or a psychologist or even a mental health provider with the correct kind of field, if there's still that hesitation, I believe in another session they were saying, go look for a general primary care, because at least they can start somewhere. They are some that are trained, and now they're doing assessments around their stress level, suicidal assessment, and there just tends to be less stigma around a physical diagnosis and that. So that's not a long-term, I will say it's not a long-term response, because eventually they will need to get kind of escalate to that professional depending on that diagnosis, but that's a good start. Mm-hmm.
Thank you. Oh, okay, we're one last comment.
Yeah, quickly, like if the person happen to be in the church or like in a faith-based community, that's actually very helpful to have the pastor involved. So we are like Asian, right? So we listen to the authority, and the pastor talk about it and can refer to us, and it would be much easier to let them seek help from that way.
Okay, I have a feeling this could have gone on a lot longer. Thank you everyone for your attention, and I'm hoping that somebody in this group will volunteer to learn more and become a facilitator, because I think we really need that in the Asian community, and I think Hope would be interested in hosting that kind of thing. And I'll check to see if we can post the presentation slides on the website. But I know that we have to go to the next talk. But thank you everyone for your attention. Thank you for our speakers.
Thank you.